Kia ora and welcome to No ME, the podcast video series where guest speakers talk about pressing issues surrounding myalgic encephalomyelitis, chronic fatigue syndrome, and long COVID. Join researchers, clinicians, and patient advocates as we take a deep dive into the most recent evidence-based information so that you too can know ME. ANZMES does not benefit from or receive any funds from any courses or products mentioned in this podcast episode. ANZMES does not provide medical advice directly to patients. Please always seek professional medical advice. This podcast is intended for health professionals seeking information on how to help patients with these conditions. Today's episode is hosted by ANZMES Executive Committee member Ange Robinson.
In today's episode, we will discuss symptom management of myalgic encephalomyelitis and long COVID using respiratory medicine and naturopathy. And we're joined today by Tania Clifton-Smith and Rodden. Tania Clifton-Smith is a New Zealand physiotherapist who has 30 years experience in the field of breathing dysfunction, breathing pattern disorders, and hyperventilation syndrome in physiotherapy. Tania co-founded Breathing Works clinics in 1998, which have treated over 30,000 individuals with breathing dysfunction. Tania established the Bradcliff breathing method, a physiotherapy treatment program for breathing dysfunction, in 2008. Tania has published many works on breathing dysfunction. Tania belongs to the New Zealand Physiotherapy Cardiorespiratory Special Interest Group, the Musculoskeletal Special Interest Group, and the Mental Health Special Interest Group. And Megan is a qualified registered naturopath and medical herbalist based in Langham in Auckland. She's also a trained journalist with a bachelor's degree in communication studies and a mother of two with a passion for plant medicine and holistic nutrition. Megan is the content writer for ANZMES and a guest writer for a health blog and website. Kia ora and welcome. Thank you for both being here today.
Thank you.
Hi, thank you.
First of all, Tania, would you like to tell us a little bit about the Physio New Zealand Cardiorespiratory Special Interest Group and what you've achieved for people with long COVID?
Well, the Cardiorespiratory Physio Special Interest Group's been very integral with the signing up of policy and writing protocols for treatment programs, which have been fantastic. And you can actually find some of the handout sheets if you go to Healthify, so it's healthify.nz, and just put in long COVID, and you'll see a lot about what is long COVID and the treatment protocols. We also have really pushed for trying to get funding for treatment for individuals with long COVID, which was there for a wee bit, but it's gone. So it is so sad. We're really, especially, a couple of the key physios, Jen and Sarah, are pushing for funding to continue through Te Whata Ora, but I don't know. We'll see. We'll cross our fingers.
Fingers crossed with you. So You've been a physiotherapist for many years. What made you specialise in treating disordered breathing?
Well, I ended up in a clinic in the late 80s, early 90s, where the key focus there was seeing individuals with burnout, exhaustion, fatigue, and they were, high profile individuals. And the primary treatment modality was actually look at their breathing before you did anything else. So look at breathing before you actually did any talk therapy. Look at the breathing before you actually did any sort of cardiovascular therapy. So it really sparked my interest since then, and I have dedicated the last 30 years to it. Yeah.
So how would a health professional recognise disordered breathing in clinic?
Well, it's actually quite simple when you know what to look for. And basically, we know that adults at rest, children, teenagers, babies, all have a preferred rate of breathing and a preferred pattern at rest. And so any health professional just needs to observe. So, for example, at rest, an adult should breathe 10 to 14 breaths a minute in and out of the nose and using the abdomen. So if there's any variation from that, if someone comes in mouth breathing, panting into the upper chest, or interspersed speech like this, you have to ask yourself as a clinician what's going on and why.
So what would you recommend they do to help their patient? Tests, referrals, that type of thing?
Well, it depends. I mean, if you're looking at a GP, the most important thing is okay, they've got a disordered breathing. You've got to figure out why. Why is there a disordered breathing pattern? And you obviously have to rule out anything sinister that is driving the deficient pattern. If that is being done, and they've done all the tests, they've deemed to do the back checks, they really should send to somebody who actually is skilled in treating this, because it is an individualized tailor-made program. It is not a one thing fits all, because it depends on why you've got the disordered breathing. Is it because you're not nasally, you can't use your nose, or is it because you're so used to breathing into the upper chest, you've got to learn to breathe with less air? So it is, it's big. I mean, I've looked at it for 30 years. So you really do need to refer to someone who knows what they're doing. That would be my advice.
Good advice.
But recognize it firstly. And also you can actually bring the awareness to the individual and say, hey, do you realize that you're breathing really quickly or fast, or and ask them, what is that about? So it's brought the awareness to them.
That's great advice. Would you like to tell us more about the Bradcliff breathing method?
Well, that really evolved because, within physiotherapy, we've got many different disciplines, musculoskeletal, and we found that there really was a need for a specialist area. Cardiorespiratory physiotherapists are very skilled with this sort of work as well, but the Bradcliff probably was a bit broader and considers anyone with a breathing pattern disorder, from a child with asthma through to elite athletes, because elite athletes also need to know how to breathe well for efficiency of movement. So it covers a spectrum. You look at how someone breathes, you look at the volume, you look how it affects you, anxiety-wise, things like that. So it is a very comprehensive methodology that looks at many different individuals and disciplines and works to assess why they've got the disorder, what triggered it, and then a tailor-made program for them. Yeah.
Great. And you've been treating COVID patients and people with long COVID. What are the most common symptoms and issues that they face?
Yeah, well, I've probably been more on the education side, but I definitely know from colleagues internationally and nationally that the main signs and symptoms that we see are cough, breathlessness, so shortness of breath, obviously brain fog, obviously something called post-exertional malaise, so your fatigue, and especially your fatigue with movement, chest pain, something called POTS, postural orthostatic tachycardia syndrome, where you stand up and your blood pressure drops and heart rate goes fast. So for us, they would be, and obviously worry, what's happening to me. So they would be the main key things that we see clinically. Yeah.
Yeah, great.
And definitely, the biggest thing reported is a breathing pattern disorder. So the breathing is totally disproportionate to the activity. That is number one.
Right.
Yeah. Yeah.
So Megan, you see people with both long COVID and people with ME. How do the symptoms mentioned by Tania compare to those experienced by people with ME?
Yeah, so I have a small clinic and part-time, but word of mouth means that I see long COVID and ME patients, and I do see it's definitely long COVID is more prominent, that cardiorespiratory picture that Tania's just described. It's definitely those types of symptoms are prominent, but to be honest, there's a lot of similarities. So patients with ME, they also have some cardiorespiratory stuff that can come up too, especially when there is that dysautonomia. So that's the POTS, that's the orthostatic intolerance. So they both describe things like palpitations, breathlessness. When you work through the symptom hierarchy of what needs most urgent support, cardiorespiratory seems to be higher up in the long COVID than what it is in the ME. But ME also really differs from case to case depending on the triggers that they've got. So there can be a bit more of the gastrointestinal stuff going on for ME, but that doesn't mean to say that that's not also present for long COVID. Overall, I really do feel like there's more similarities than there are differences, but it would just be that cardiorespiratory prominence, I think, for long COVID. Yeah.
Okay. And how can naturopathy help people with chronic conditions?
So naturopathy is a holistic approach, and I think that's sort of the real reason why chronic conditions can be supported through the modalities that we do. We aim to restore balance, homeostasis, and these are with simple things often like lifestyle modification, some herbal medicine added in there. The core philosophy is the healing power of nature, but it's also going back to that inherent healing process that restores our health that's within our own bodies. And so really just supporting those mechanisms. And that can be creating a foundation for better health. And so I think with a chronic health condition, these things don't occur in isolation out of nowhere. Somebody doesn't just suddenly get a chronic health condition without anything else going on. And so what we do is we peel those layers back a bit like an onion, and it's a lengthy process actually, as is developing a chronic illness. And I think it's that spending that time with patients as well. My consults are 2 hours. We really get into the nitty-gritty of what's going on for you, and we remove things that are contributing to poor health, contributing to disease, toxins, mold, poor diet, and we add in things that are going to restore health. Stress management is huge. We help manage symptoms that are ongoing, and inflammation can be a really big driver too. And there's lots of things that we can kind of do that are actually quite gentle for somebody in a poor chronic health condition like ME, which can just peel those layers back of the things that are aggravating and perhaps preventing you from having a good quality of life. So that's kind of where I feel like it fits.
So people in medicine are often concerned about quality and quantity in supplements. What would your advice be?
Yeah, so it's a tricky one because I think probably my biggest thing would be don't self-prescribe. Go to see somebody who is trained, and don't just walk. There's a plethora of stuff available, and I'll get clients coming in with literally a shopping bag full of stuff that they've picked out for themselves, and I will tell them to stop taking 90% of it, to be honest. So naturopaths actually have quite significant training in this area, and our continuing education is around this as well. We deal with a lot of the manufacturers of this, and there are some amazing companies manufacturing plants that are, Douglas Pharmaceuticals makes clinicians, those kind of ones, and they have rigorous quality standards. And so I look for, especially with chronic health problems and things like ME, I'm looking for low excipients. So nothing weird added. I stay completely away from anything that's full of fillers, that's full of proprietary blends. That's something to steer clear of. A proprietary blend means there's no real indication of how much of a variety of things you're actually receiving in that. So, and it will often say proprietary blend of blah, 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 and so you don't want that. We steer clear from that. And there's actually, there's a lot of studies that show that with ME in particular, there are nutrients that are specifically deficient more than in other conditions. So we've got CoQ10, NAD. A lot of people supplement with magnesium. That's one that I prescribe quite a lot, but I'm very careful about the form that I use. So the form matters, because magnesium citrate, while it's a very popular product, you'll see that mostly in the chemists, magnesium citrate has a strong laxative effect. So for somebody with IBS, that's going to be quite unpleasant. It's, they're not going to be looking for that. Whereas there are actually gentler forms on the gut that don't give that same intense motility effect. And so magnesium glycinate, biglycinate, L-threonate is another really good one that's really good for sleep. So you really got to know what you're looking at. And so I just can't sort of bring that home enough to just go and see a trained professional. That could be your naturopath, or it could even be your pharmacist, because they've prescribed you your medications. They know what you're on. They know what might interact and what might not. So, just get that professional advice is what I would say.
That's incredibly helpful. Thank you. Complementary medicine by its name is designed to work alongside conventional medicine. So what advice would you give a GP whose patients want to use alternative therapies?
So for a GP, I would say, look, there's a number of things that they might be wanting to try. For someone with a chronic health condition, I would just say, again, go and see a trained professional. So make sure that they're not just going and picking stuff out, especially herbs and stuff like that, because again, there's a lot of things that can interact with your medicines that you're taking. Warfarin's a big one. We don't want to interact with that. So I think herbal tea is an amazing place to start for somebody who's very chronically ill, and get them to try one thing at a time and see how it's sitting with them. Just go slowly. Slow and steady wins the race. So just chamomile tea could be a lovely place to start if you're really unfamiliar with that kind of thing. And just check that they're seeing somebody who, like myself, is registered, educated, they're ticking all the boxes, they've got that training, and they're making sure that you're not contraindicating anything that they're doing. Also for GPs, I would just say, if you're not sure, reach out. Us naturopaths are quite friendly, and we're happy to chat. We're happy if you've got concerns and you've got someone coming in and they said, oh, I'm taking this, this and this, have a chat to the naturopath and see if you can reach out to them, because they're likely to be able to help you to get something that's going to be complementary with what you want to do and not interfere with anything.
Lovely, thank you. Megan, you were also diagnosed with ME yourself. Would you like to tell us a bit more about that?
Yeah, sure. So my diagnosis was about 12 years ago, roughly, and I was a busy mum. I was working part-time as a communications consultant, and I initially came down with viral illness and was told it was glandular fever. Then post-viral fatigue. That's what when I sort of didn't recover, that's what they put it down as. And then when I continued to be unwell, I was diagnosed with chronic fatigue syndrome and fibromyalgia. So I didn't have the greatest experience with the health professionals that I was dealing with. And I didn't have a great experience with friends or family either to that diagnosis. I felt there was a lot of disbelief and a lot of negativity, and it was very hard to get anyone to take my symptoms seriously. I mean, I had a fairly supportive GP, but they were not aware of what to do with ME, and they called it chronic fatigue syndrome. I had my GP referred me to internal medicine specialist who basically said, well, it's either all in your head or it's chronic fatigue syndrome. And your doctor sent me all these notes and I really can't be bothered reading them all. So, that wasn't the greatest experience. So I kind of went into a state of denial, and it was for quite a long time. I just stopped. I started ignoring the symptoms, and I stopped talking about it as being ME to anyone. And just I really gave up because I just was getting so much negativity and it wasn't working for me. So unfortunately, that made things a lot worse, and I got sicker. As you know, with the positional malaise, that's kind of how it worked, and I got stuck in this cycle of crash and push and crash and this kind of typical thing. So it wasn't really until I saw was actually asked to be a case study for a naturopath, a student naturopath. And so that was a turning point for me, just because they listened to me and took me seriously and actually helped me to learn about what was actually wrong with me and a lot of the symptoms, and talked to me for the first time like I was a real person, and it was that kind of just led me on a healing journey for myself and a journey to educate myself more and more and more. And so that's kind of where I went with that. And so became a naturopath because it was so healing for me. And so it was just that snowball effect, I think. And I just became really passionate about aspects of it. And that's what brought me to where I am now.
And now you currently have your clinic and you're the content writer for ANZMES. So obviously you're doing quite well health-wise now. What do you believe contributed to this?
Look, I think recovery was slow and steady, as I say, and I say to a lot of people that I'm working with. And I think I really couldn't tell you that there was one cure or one thing. It was a number of culminating things that allowed me to recover and heal. And so pacing, style, stuff was really big for me. So I saw a really good physiotherapist, and that was very helpful for me to work through not just that kind of headspace around how to manage my energy, but also other symptoms that I was having. Like I had interstitial cystitis, so I was having a lot of bladder problems. So, managing those symptoms, even just posture and how to sit on the toilet when you're having these kind of pains and stuff. It sounds simple, but for somebody who's struggling every day, these things can be cumulative, and over time, it can really make a difference to how recovered you feel. And I think herbal medicine for me was amazing. That was a put in at the right moment, I think, for where I was at, and I was able to build on that. Things like convalescing stuff that I feel like we've forgotten about when you are really ill and really busy and really stressed. Just not overwhelming your body when with excess amounts of different foods and stuff like that. So yeah, it was a really slow, steady process, but I got there in the end.
Nice. Tania, what advice would you give to people with long COVID around pacing?
Well, I think the key thing is, thanks Megan for your story. Yeah, I've sort of been involved with the treatment of chronic fatigue and ME for about 30 years as well. So this wasn't new to me, the long COVID stuff. It's really, the 4 Ps, think about your day, problem solve, plan your day, prioritize, and then pace. So with that, often I used to say to a lot of my clients, imagine you've got 10 teaspoons and that's your energy. Work out wisely where you want to use your energy. But once you've spent them, it's gone. And if you overspend, like if you're going to a wedding or have got a serious function, just know the next day you've spent too much. You got to put some more back in the bank. So really it's prioritization of your energy. A big one is pacing with your breathing, meaning that so often, obviously when you're exhausted, it's even going to the mailbox and you're just totally exhausted. It's learning, it's called cadence, regulate your breathing with your movement. So it's take 5 steps, have a breather, 4 steps, have a breather. Even things like you breathe in and you breathe out. So if you're reaching up, breathe in and breathe out, because that's a natural movement with the body. Breathe in, breathe out. You're doing up your shoelaces, breathe in, breathe out, but don't hold your breath, because that sends a message to your brain it's in danger and the nervous system gets going. And the minute you start to dysregulate your breathing with movement, yet again, it sends a message to the brain that, you're exercising. Well, you're not. You're actually just walking. So you need, the whole thing, work out your energy units and then pace it. Really think, am I getting breathless? Whoa, ease back in. As Megan said, awareness of opening up, because this, we do this when we're tense and tired, but This is really good because this takes out all the over breathing muscles. So, we see athletes do this all the time. Yeah, it actually encourages you to abdominally breathe. And if you can't put your arms up, put them behind your back. It's a beautiful, beautiful position. So yeah, we really encourage, listen to your body. Really important. I think what Megan said there, we have tools within ourselves that are so powerful. And I feel if GPs just could actually give simple advice, like listen to your body, pace it, plan it. There is a lot that people can do that gives them autonomy and power over their own health.
That's great. Thank you. Megan, what are the key things for people with viral infection to remember?
Yeah, I think going back to what Tania's talking about, which is, it's pacing yourself, going back to those, the way we used to treat an illness, we used to convalesce, and if you look at traditional medicine like Ayurvedic and traditional Chinese, a lot of them actually still kind of utilize these techniques, and it's going back to just pace yourself. Think about building a foundation for recovery, and if you're really unwell, that's going to be deliberate rest. Build a foundation first of hydration, nutrition, pacing, support your weakened systems appropriately. So I also love, with the 4 Ps for pacing, I love the prioritize pleasure when it comes to somebody who's dealing with this chronic illness, and it can be really overwhelming because you can feel like the only thing I have energy for is, well, I've got to do this chore, and I've got to do that thing, and I've got to do that. And if you spend your whole energy bucket on that, you're going to be feeling very depleted inside as a person. And so, okay, obviously counseling and things like that can be really helpful, but prioritizing pleasure helps put it back into your hands to say, well, actually, no, I still, just because I've got this illness, doesn't mean I don't deserve to be a happy, well-rounded person. And so I might only have 4 hours of functionality, but I've got to fit in there somewhere something that makes me feel good and keeps me going as a human being. So, realizing that for me and for other people, it's huge. That's a really big one. So I have to mention that one.
It's true.
And Tania, if you could give 3 key tips for health professionals about the management of long COVID, what would they be?
Well, I think the first one, Megan touched on it. This is real. Listen to the client, take it seriously, do not dismiss them. So, if you don't know what you're doing, seek out a specialist that does. But number 1 is listen to the client. I think that's really huge. From obviously my perspective, something simple like look for dysfunctional breathing, look at the symptoms, check out, for a health professional, what they've got to do is look at it seriously, probably check if it's long COVID, make sure that, go through the checklist. If it's myocarditis, check all those things thoroughly, work out anything sinister. If that's fine, then, refer to the specialists. As Megan said, there are a lot of people out there that know what they're doing with respect to, ME, CFS, long COVID, and there's a lot of protocols that actually work. So, refer on, don't try and do it yourself. And there are a lot of resources out there. There's a lot of, I know Mr. Google and people don't like that, but, go into and look for books, look for things like that. But I think number 1 is listen. Number 2, take their symptoms seriously. Prioritize the symptoms and tell them, yes, there is things that can be done and they can recover, albeit lengthy, but it's I've seen this for years with people, not just with these disorders, but chronic stress, depression, anxiety. It's all about listening to your body, trying to come back into what we say is homeostasis, which is just balance of all your systems. So it's loving yourself and looking after yourself with, listen to your body, listen to it. That would be my sort of words of wisdom.
And what would you like health professionals to know about these conditions, long COVID and ME?
That's sort of a loaded one. I think the main thing is to know that it's real. just, it is real. Never dismiss anyone. It is real. And if you don't understand it, read your research. In a way, because I've been involved with chronic fatigue, ME, and probably, anxiety disorders for a very long time, long COVID has been quite a good thing for people, because the medical profession is starting to research it and look into it and starting to believe it is real. There is so much more research that's been going on in the last 2 years, and yay, thank goodness, there is stuff finally being done about it. So look, there is a lot of articles, a lot of medical research being done. Read.
Right. Megan, anything you'd like to add?
Yeah, no, I mean, I think I agree with a lot of that, and I just think, listen to your patients. They are the only ones in their body, and if they say they're experiencing something, listen, and don't just dismiss it because it doesn't fit the list typically of this blah blah blah, because sometimes they've got other things going on. They don't just have that one diagnosis. And there are so many resources there now for us to there's no excuse for saying that this is a psychological condition anymore, either of them. There's no reason for gaslighting or any of that. There's no need, because the research is overwhelming saying that it's biomedical, and there's some amazing people doing amazing work, and listen, and work together with people who are trying to help these patients as well. So that for me, just work with complementary medicine practitioners, because they're seeing your patients, and the patients want you to respect their choice to do that, and that's what they tell me. They say they don't want to be made to feel stupid for making whatever complementary choice they've made, and they would love for you to work together with us. So just give us a call, give us a chat. We're happy to discuss it. If you have any concerns, we will talk to you about it. Yeah.
I agree.
Is there anything else that either of you would like to share with our listeners?
Not really, but I think probably don't lose faith, because there is research is really progressing, and there is a lot coming out that you can do. But in the interim, really respect, use the 4 Ps, use that energy wise, listen to your body. And don't give up hope.
Megan?
Yeah, I agree. Definitely don't give up hope. There's a lot that you can do to build a foundation for your body to recover, and listen to your body. And I think if you're struggling to be heard, don't give up on that. You will find someone in there, and there's more and more people listening now. So, but if you don't sort of get there, keep asking, keep trying, because you will find someone who can help you.
Lovely. Namahi, thank you, Tania and Megan, for being here with us today for this episode of No ME. It's been a very useful discussion on respiratory medicine and naturopathy for ME and long COVID, and we thank you for gifting us with your time.
Not a problem.
Lovely, thank you.
Thank you. You've been listening to or watching an episode of No ME, a place for you to hear the most up-to-date evidence-based information on ME. Thank you for joining us, and tune in next time for an update on the latest biomedical research. Ka kite anō.